you want to train in that one, just stick the needle in the sandbag. All right, this one you can actually stick the needle in. When you walk up, you have a dummy, 8 litter bag. All the equipment that you need will be nicely packed in there. It's going to be a little crazy right now since you were just fucking pulling things out, putting things back in. You're going to have a chest seal. All right, an unopened chest seal. I don't have enough right now to just keep opening and using them, so we're reusing them. All right. Read off task and standards. Task, treat a chest wound and tension pneumothorax. Condition, you are a member of a team on a combat patrol that has come under small arms fire in a non-CBRN environment. You witness a teammate in the open receive a gunshot wound to the upper body. Your teammate was able to move to you and is responsive. You are behind cover, not under hostile fire, so you can take off your gloves for this lane, and security has been established. You must begin treatment while waiting on medical personnel to arrive. Casualty is alert and complaining of difficulty breathing. Another soldier is helping you finish the casualty assessment and is obtaining other vital signs. Standard, you must perform all tasks standard in sequence within 10 minutes without causing further injury. First step. All right, cool. Zero's on the clock. Ready. Time starts. Open up the top, exposing the chest wound. You see the chest wound. Test week. It's gonna be a nice piece of tape there. That will be replaced every time. For now, we're just using that. All right. Place your hand over the chest wound, creating a temporary seal. Grab your gauze. Wipe away blood. All right. Notional blood's gone. Cool. Whip out your chest seal. Take it out of the package. And then you're gonna take your hand off. Say that you are waiting for the exhale.
Waiting for exhale.
Place the chest seal on without touching the adhesive side. It's the back of the chest seal, the sticky side of the chest seal. Don't touch that. All right, chest seal's on. Place your hand back on, making sure that there's a nice seal. And then you're gonna tape 4 sides with 2 to 3 inches of tape. Kind of silly because it's a self-adhesive, it's adhesive chest seal, but you still gotta do it. All right, you got it taped down. Cool. Now you're gonna roll over the casualty. Whatever method is preferable. Some lanes here like restore breathing, have containers for rolling the casualty. Some lanes not. Yeah, roll the casualty. It's kind of flimsy, so do the best way you can. All right, put the blouse up, exposing the wound. I kind of got it right there, it's fading away. Wound's right there. Place your hand over it, creating a temporary seal. Grab your gauze. Repeat the steps that you did on the front. Wipe away blood. Chest seal. State that you're waiting for the exhale.
Waiting for exhale.
Place chest seal over the wound. You got to pull up the blouse a little bit more to get that chest seal on. Go ahead and do that. All right, place your hand back on, make sure that there's a good seal. Tape 4 sides with 2 to 3 inches of tape. 2, 3, 4. All right, you're done with the back now. I'd recommend that when you're training, you rip off the chest seal and just pull it off to the side. That way you don't have to do it at the end. All right, roll the casualty back over. All right, now you're going to state 3 of the 5 signs of tension pneumothorax. It's going to be right here. It says A, B, C, D, echo. You need to do 3 of the 5. The easiest ones that I think, are the easiest are A, alpha. Do you have difficulty breathing and pain on the affected side? So, as the candidate, you're going to have to verbalize this to the grader. That way we know that you're doing it. Because we're not just going to know that you're looking for that. The grader will state casualty is gasping for air and has pain on the wound side. Once he says that, you can move on to the next one. Charlie, looking and feeling the patient's chest for signs of air in the chest wall. Grader will state you feel a crackling sensation in the casualty's chest. And then echo, looking for bluish skin. Grader will state you observe mild cyanosis. Once you get those 3 back from the grader, you can go on to step 3. Identified needle decompression site. In your book, it's going to say it's the 5th intercostal space. For this dummy, what you're going to want to do to identify it is you're probably going to know it's already at, but start poking around. This one right here, how it is exactly the same on this side. So the needle can only go right in here. Try to put it right here. It's hard plastic. It's just going to stop. All right, So just start poking around until you find it. All right, cool. It's right here. So you got it. You identified it. Take your alcohol wipe. Wipe away the area that you're going to stick the needle in. Take your needle out at a 90-degree angle, pretty much straight up and down. If you're going at from like some weird angle, this is going to hit the hard plastic. All right, you got it stuck in.
Waiting 5 to 10 seconds.
State that you were waiting 5 to 10 seconds, or wait 5 to 10 seconds. Pull the needle out. Not a performance measure, but stick the needle back into the holder so that you don't stab yourself or others. Grab some tape. Rip off about 2 to 3 inches of tape. Tear about an inch down the middle, and then tape the catheter in place. Do not put the tape over the hole of the catheter, right? All right. Now, very last step with the cavity is you're going to state that you're listening for increased breath sounds.
Listening for increased breath sounds.
All right, you need to verbalize that to the grader. All right. Now you can forget about the casualty. You can move on to filling out your TCCC and getting your O2 set and your pulse. So in the book it says you can't use the casualty. You got to use yourself or the grader. Obviously you don't want you guys sticking that on us like 1,000 times. So just use yourself. So what you're gonna do is you're gonna clean your finger with an alcohol wipe. Stick that bad boy on you. All right, it's gonna be pre-filled out just in case it malfunctions or for the eventual state that it does break. All right, top is gonna be the 80. That's gonna be your O2 set. And the bottom, 100. That's gonna be your pulse, right? As indicated by the heart. That looks like it's kind of like beating. All right, you got that? Grab your TCCC. I don't have a big whiteboard here to show you how to do this. I got this. You can take a picture. There's some over there too. During test week, what we're gonna have is a laminated piece of paper here, and then there's gonna be a TCCC card attached to it. I don't think we have enough of these. You're just gonna fill that out, and then you're gonna do that. The very last step is to stick this into the casualty's pocket. It doesn't matter which pocket. What you gotta do on here is on the front, fill out the evac category. You got shot in the chest, so the evac category is gonna be urgent. Date 08-April, as in APR-24. Time, whatever time it is, so let's say 0800. L for local. Mark an X on the entrance wound casualty, which is over here, so you're marking X. And mark an X on the exit wound casualty, which is on the right side, so you go over the right side, because the casualty is facing away from you now. Mark an X there. Go down to signs and symptoms. The time, whatever time you took the readings, probably about a minute before you filled out this time, right? So I filled out 08 on here, so I should probably put like 079. So 079 L for local. Pulse, rate and location. Pulse, look at that. All right, it's 100. R for radial. You took it from the wrist. That's your radial pulse. Got it from your finger, right? Pulse, O2%, O2 set. That's your O2 set. That's what's the 80 on there. All right, you write 80%. AVFU, right? That's an acronym. It stands for alert, verbal, pain, or unresponsive. He's alert, you write A. He's verbal, you put V for verbal. He's obviously in pain because he got shot on the chest, so you put P for pain. He's not unresponsive, he's talking. Flip the card over. Mark urgent again on the evac category. X on needle D. Mark an X on chest tube. The type of seal that you're using. You're gonna have 2 of these in front of you for test week that you just opened, so you can look at it. It's a beacon chest seal. So you mark beacon as a type. Go down all the way to the bottom where it says first responder. That's you. Write your last name, first name, last 4, DOD, social security number, 1, 2, 3, 4. Confirm that. Take this card, secure it in the casualty's pocket. The grader will take it, look at it, you'll get your go. We're taking the chest seals off.